Breaking news. New information released between the relationship of zinc and the coronavirus. Over the past year, doctors, scientists, and nearly everyone have been informing themselves and society how best to prevent and deal with the current virus, COVID-19. The vitamin zinc is one element that leads us in the right direction in fighting the virus. We will be covering zinc, its concerns during deficiencies, but most importantly, whether it can decrease the spread in the body of the virus COVID-19. It's well known, especially from taking Nutrition 230, that nutrition takes an active role in our overall health. Not just worrying about, say, if we get enough protein in our diet or counting our calorie intake, but considering how much vitamins and minerals we consume in the foods that we eat. Zinc is a crucial vitamin in our diet that has many benefits. You might be thinking, what even is zinc? It's a vitamin we often hear about, whether it's a supplementation recommendation at the doctor's office or seen on a nutrition label. But what does zinc even do? It is an essential trace element and micronutrient, as it's an element found in all living beings. Zinc plays multiple roles in maintaining biological and immune-related processes, such as fighting off bacteria and viruses. It also helps with cell division and growth, such as making proteins and DNA. It is what helps prevent respiratory diseases like the cold or flu. The way in which this occurs is by zinc activating enzymes to destroy proteins and viruses to decrease the spread. Just like we start taking cough or cold medicine as soon as we feel the start of flu-like symptoms, it's recommended that we should take zinc supplements as soon as symptoms arise to shorten the infection duration in the body. In fact, in a lab study conducted in 2010, researchers found that zinc lozenges inhibit a similar virus, SARS-CoV, from spreading and replicating in the body. Although the research is not far enough along to know for sure how zinc would treat COVID-19, taking zinc lozenges have been proven to reduce the length of a cold and its symptoms, therefore leaving hope that it will help with the pandemic in a similar way if zinc is taken in the early stages of COVID-19. Despite zinc's significant presence in the body's functions, it's a very common deficiency among the human population, causing a huge concern for immune support. In zinc deficiencies, antibodies and cell-mediated immunity that fight infections are diminished, causing a weakened immune system. A zinc deficiency is caused by the lack of presence in the body as well as malabsorption. When the vitamin is malabsorbed, the intestines don't work properly to absorb nutrients. This may be due to the presence of medications which interfere with the absorption of vitamins, decreasing their availability in the body. The lack of zinc in the body is closely related to not only fighting against damaging free radicals and bacteria growth, but can shorten the spread and duration of infections. You have probably heard on the news that the elderly have a higher risk for getting the coronavirus. The reason for this is because as people age, their immune system gets significantly compromised. A zinc deficiency is often one of the many deficiencies that the elderly experience, which is very concerning due to their already compromised immune system, and even more so during the COVID-19 climate. Aging and taking medications decrease the ability to absorb nutrients such as vitamins and minerals. The best way to combat zinc deficiencies is to be mindful of what elderly individuals are putting into their bodies and to possibly take a zinc supplement. Like previously mentioned, medications interfere with the absorption of vitamins, which increases the likelihood of deficiency. Today's society is constantly trying to find the best so-called superfoods that offer the most nutrients and have great overall health benefits. As we now know, zinc should now be a sought-after ingredient. It's crucial that we consume zinc-filled foods, especially during COVID-19, and even more so now that the colder weather is approaching where infections arise. Foods such as beans, chia seeds, almonds, oysters, pecans, and oatmeal offer a substantial amount of zinc per serving. Also, including zinc supplements in your daily routine is a great habit if your zinc consumption is low. What do I recommend to benefit your health and to fight against COVID-19? Make sure you're taking your zinc. Women should be taking 8 milligrams, while men should be taking 11 milligrams, whether that be in form of a vitamin or in your food. Also, if you experience any cold or flu-like symptoms, to increase your zinc intake to shorten that infection. Thank you. Now back to your scheduled program.